And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So are you going to tell those parents to just wait when it comes to the sinus infections with their kids?
Well, I don't see kids, luckily, in this situation.
Luckily for you.
Lucky for me, but obviously we see this a lot in the adult population. We battle the patients all the time. Unfortunately, our culture loves antibiotics for a lot of different things, and a lot of times there is some pressure from the general public to prescribe antibiotics, and unfortunately we are in a business and we're trying to keep our patients happy, otherwise they'll go somewhere else and get it from someone else. So a lot of times you do write that antibiotic when maybe you feel like they could wait 2 or 3 days, but it's nice to know the literature is coming out, it's getting out into the general public so they understand that you're not trying to be mean, you're not illiterate, that you're up to date on the current literature, that this is what the scientists, the specialists, the people who study these diseases are recommending for your own good, so that we can make the best decision. And so it's nice to know that they're doing that in a pediatric population. It'd be nice to see that in an adult population because it is a common problem, especially in Southeast Texas with the weed, the pollen, etc. So try to limit antibiotic usage. It's not going away, so it's an important aspect of delivering health care because antibiotics can be risky and can cause a lot of problems. So if you can do without it, do without it.
All right, some other medical questions. We've got lots of viewers. Let's get to those. My husband went to the doctor and was told that he had a clogged saliva gland, but now he's having discharge by his back tooth. Could it be something else?
Probably so. I think those are two different things. A saliva gland, typically on the face, we call that parotitis. That's normally going to be very red and swollen. And if it's not treated, it can get pretty bad and painful. And the tooth is probably something different. That may be another bacterial infection causing the drainage in the tooth. If these two are connected, that's a serious issue. And certainly would recommend they get to the emergency department for some IV antibiotics and possibly surgery.
Do you go to a dentist for that?
A lot of times, no. You don't go to a dentist for the gland. Obviously, you might go to the dentist for the tooth, but a lot of times they'll say cool it off with some IV antibiotics, and we do have surgeons who do operate on teeth. They are in their offices, but a lot of times because it's painful and they look sick, a lot of times they have to be hospitalized.
Okay, another one. What's the best treatment for heat rash?
I'm not quite sure what heat rash means. I think maybe a lot of times when you get just kind of redness on the skin or lighting of the skin, what we call hyperpigmentation or hypopigmentation, a lot of times that's fungus related and can be treated with Selsun Blue, some fungus shampoo, or even some cream or some tablets. Okay.
Do you know what CMV is? I found out the hard way. More pregnant women should know about it. Stop CMV.
Yeah, it stands for cytomegalovirus. It's a potential infection in pregnancy. It's controversial about screening. There is no active treatment for it typically, so you can't ask to be screened for it. But it's very controversial, and if you want to know about it, certainly ask your obstetrician.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This person wants to know, what's the best treatment for sunburn?
Probably just stay out of the sun. That's probably the best treatment. But
they're not going to do that. We've got July 4th coming up.
I know. It's hard to do. To be honest with you, a lot of the over-the-counter topical things work really well. Sunburn, basically a first-degree burn, typically, depending on how bad it is. So I would just go to the over-the-counter supermarket, CVS, look and see what they have and use that.
Aloe vera.
Absolutely. They have some things that contain vinegar. That might smell a little bad, but the best thing is just try to reduce your exposure. Use a lot of sunscreen, highest SPF, apply frequently, and just try to limit your sun exposure.
All right. I have dry skin and have these things like scabs, and when they itch, they bleed. What is it, and what type of medication do you advise?
Dry skin can sometimes be related to fungal infection, as we mentioned earlier. It can sometimes be related to eczema and other illnesses. Sometimes you need a biopsy to figure that out. A lot of times we just start with topical corticosteroids because it typically helps soothe the inflammation, which a lot of times when skin is inflamed, it's itchy, it's vulnerable to bleeding. So probably I would try that, make sure that their chemistries like the thyroid looked okay as well.
Is it possible for you not to be able to go into labor by yourself?
If you've had too many of the breathing shots, I'm assuming if someone has asthma or COPD, and they get those injections or shots that might impair the ability to go into labor. I don't know anything about that. You know, you may need to ask an obstetrician. Typically, you know, a lot of things can influence that, but as far as I know, I'm not aware of that.
Okay. How much radiation is there from a CAT scan?
I really don't know. There is a lot of concern about that. It is a small dose. A lot of times, if you're getting a lot of CAT scan, there might be some exposure, but not enough to really increase your risk of having any cancers, which is why we try to talk to patients about limiting their exposure to x-rays. But as far as I know, it's not a huge amount, and it is safe.
Okay. What are the options for affordable cancer treatments if you don't have insurance?
That's always a difficult question. Sometimes they will work with you, a payment plan, etc. Sometimes trying to get you on insurance, Medicaid, Medicare, but that is a very difficult question.
Okay. A 57-year-old male has night sweats. What could be causing them, and should he be concerned?
Absolutely. Anytime there's any ongoing problem or complaint, you should get that checked out, but I would be concerned about thyroid disease, medication side effects. Sometimes I want to know about underlying malignancies, so I'll certainly get checked out, do a colonoscopy, PSA, chest x-ray if he's a smoker.
Can you get shingles, a shingles vaccine after you get shingles?
You can. It's not 100%, but it does reduce the frequency of having an outbreak, and you still can have an outbreak, but it's going to be less severe. It's not going to last as long. We still recommend the immunization for most patients. Normally we try to target 60 and above. So certainly you still can have, even with the flu and pneumonia, you can still have an infection, but it supposedly lessens the severity and the possibility of getting it. So we recommend that they get all those immunizations.
Okay. What are the long-term effects from a torn ligament if you don't have surgery?
Probably just immobility, chronic pain, probably a funny gait or walk. You know, some people might not like the way that looks. And a lot of times if they're mild, they heal on themselves and people do really well. But if it's severe, you probably need to go and get that checked out. A lot of times it causes so much pain you can't go without getting it evaluated. So a lot of times I would just get that checked out.
All right, Dr. Levine, as always, we appreciate you stopping
Thank
by.
you.
And if you'd like to have your medical question answered by Dr. Levine, you can always mail them to the address listed on your screen. Email them at laf@kftm.com, or you can send them every Monday right here on our KFTM News Facebook page.